All right, guys, this case just came in. Some people found this stray cat, Kitten, and they realized that he was not able to urinate. He was posturing to pee, but he couldn't. He was just straining and straining. They elected euthanasia, no fault of their own, because they just found a stray and weren't ready to drop a couple thousand trying to save him. So that's where we come in. We're like, nah, we don't want to euthanize him. We'll give him a shot at least. And he is precious. He's purring and everything because the girls already gave him a little bit of pain meds, and also because he's sweet. Let me get him out and show him to you. Come here, handsome. All right, here he is. So cute. Look at him. Look at him, just purring. So when I palpate his bladder, I don't want to do it again. I feel that it's really firm and full, you know, especially for his size. And so what we're gonna do is anesthetize him and get a lot of stuff done at one time. One, we're gonna draw blood for some blood work because blocked cats can have some really alarming kidney issues if they're not able to urinate. And then we are going to get some x-rays on him to see possibly are there little stones or pediatric crystals or something that is causing him to be blocked. And then third, I'm gonna try to unblock him. So actually pass a catheter through his urethra, so the end of his penis, through his urethra into his bladder to drain that thing. I am really worried about that because that's hard to do in full-grown tomcats, much less a teeny tiny kitten, but we'll try. We'll see what we can do. Y'all are gonna have to hear his purring. If you're having a rough day, just listen to that. So we're gonna get started because the sooner we get started, the sooner this little man hopefully gets some relief. I'm really nervous, but we're gonna do what we can do. I'm making the biscuits. Okay, but Frill, I'm gonna get started. Or I could just pet him all day. Oh my goodness. Tell me. This little guy is constantly trying to urinate, so irritated. Oh, but I'm sorry. They gave him some pain medication to help relax him and relax his bladder, but he's still struggling. All right, here's the x-ray or radiograph. Oh, maybe that's a little teeny tiny stone right there blocking it. That would be great if that's the only one. Bladder, nothing in there that I can see. So we will go ahead and get him sedated. God, his bladder's huge. There's no way you can tell, but this bulging right here is all his bladder. Get the right stance. Okay.
Gotta have a good foundation.
Come on.
Okay, all right, okay.
Good luck. Everybody's watching. Don't mess this up. Did you mess it up?
I don't think I messed it up, but I do think it's...
We'll take that stylet out and see. I feel like you didn't give it a baby bump.
So we're in.
Maybe I'm blocking it off with my hand, you know?
Let's just see.
No.
No?
I don't know. Go. Oh, it's in.
Is it?
I think so. Do it again.
Yeah, look at it around.
Real life, people.
That's a bummer, especially after a good stick. Let's just do the other side. Didn't have a good foundation. What are you gonna say?
I don't want that. I don't know if y'all have seen that guy with the glasses that goes through the drive-thru and he sounds like an older woman and they're like, do you want some lemonade? And he's just always like, honey, I don't want that. My kids say that all the time. I don't want that. I don't want that. Did you show her the one with the knife? In the wedding dress?
No. We've been getting some good ones lately, huh?
Yeah.
Oh my gosh, here we go. Here's our newest.
What I don't want to do is rupture his tiny urethra.
Yeah.
Look at it. Poke it real quick. So hard.
Hey.
All right, so this little grit keeps coming out, and I feel like if we can get past that, that we're gonna have a normal stream. And I'm hoping that we don't have to place an indwelling catheter because I don't know how that's gonna work. Look, here's more of it on my finger. Oh my gosh, he peed it out because he had to go so bad. Hold on, here we go again.
Oh, are you serious?
Yeah, like there was pressure on it where you shot it back out because he's like. Oh, whoa, look! Eureka! He's peeing! I'm so happy.
Me too.
So we did multiple passes and it's like finally a bunch of sludge broke through. I say that, now it's not going to. It's like we're just working through all of this sludgy sediment. Ugh, now he just lost his good. So I'm just literally manually massaging at the base in case there's a bunch of sludge in there where it wraps around the pelvis to go to the bladder. Don't know why, it may just be witchcraft, but whatever, I'll try anything at this point. So I was able to get a 3.5 French Tomcat catheter in, which flows much better and is allowing me to completely drain the bladder, which is what we wanted. Look at that. So we'll see if there's crystals or what. The thing is, I don't like leaving these catheters in because they're really rigid and it can be very irritating to the bladder. So typically I think of these Tomcat catheters as like, okay, we're gonna unblock if we have to use something more rigid gently so we don't perforate the urethra. And then once we kind of get that passage cleared, we're gonna try to put in a red rubber or something more flexible and gentle. But for now, I'm probably just going to flush his bladder out. I'm gonna flush it in and out with saline and hopefully get all that sludge and then pull it and just see if he can urinate when he wakes up. Here's his urine. I'll try to get it to focus, but you can see there's like some grit in there, almost like sand. We'll look at those under the microscope. And then this is the end of that last catheter and it has that same stuff in the end of it. I'm scared to push it too hard, it's gonna spray everywhere. But that's what's in the end of that right there, is a bunch of grit. All right, here is the slide of that sediment, and actually really no crystals. Lots and lots of white blood cells and red blood cells everywhere, bacteria. So it looks like he just has a really severe UTI, and all the white blood cells and pus basically obstructed his penis. So hopefully we can treat him pretty easily. The question is gonna be if he urinates on his own when he wakes up or not. Our little kitty is waking up. He's on a little hot rock. It's pretty groggy, but hopefully he wakes up more comfortable because his bladder has been completely voided. So cute. Hey, little friend. My goodness, he's gonna be hard to keep still. All right, here's the blood work for our little blocked kitty. Pretty much what we'd expect, high white count from that infection, and high kidney values, BUN, creatinine, phosphorus because of high potassium, because he was blocked and his kidneys were trying to get rid of those waste, but he was not urinating them out. So we're gonna have him on fluids for a few days, diuresing him, and then we'll check those every 24 hours. All right, let's weigh our little dude, 1.9. Look at that belly though. Wow. Can I come again? What's it do? You have teeth. It'll be fine. Terrible for blood draws, fine for other things. So cute.
I just felt so bad for him being in that cage.
Oh, just screaming.
Yeah.
He's gotten better, but yeah, the first few days. They are my friends.
Good morning. We are here with Clancy. This is morning 1. So Clancy was admitted yesterday. Dr. Carey and I put in the catheter, expressed his bladder. He is doing so good this morning. Oh my gosh, cute, cute, cute. Here we go. The technician's actually already fed him this morning. He ate great. Don't know if you can hear all the purring and loving. He is super affectionate. Just wants to jump in our arms. Bam, ate great. Bam, peeing on his own. So we're very excited about that. That was a big concern. If we were gonna have to put in an indwelling or a urethra catheter. to leave in, which we didn't because he's peeing on his own and we expressed it. So hopefully he'll continue to do that today. He just wants to be in our arms right now. Okay, buddy, you gotta go. You got other stuff to deal with. Oh. And then we have to thank the technician over there. We have a loud patient. This is like the 15th time we've done this video.
Oh my goodness. Our Vet Ranch fan and Patreon named him Clancy, which means Red Warrior. We went with that name. And he did pee-pee overnight, which Dr. Judd got a video of, so that is super exciting. You look so tragically sad. Plan, man. Fancy pants. He's so cute.
I feel like it's this fall, maybe.
It's like, I feel so good. I got drugs on board. I can pee-pee. Oh my God. Stop. He's so cute. Lots of pee-pee this morning. Of course, not in a litter box that we have provided, but truth be told, I don't care. I'm just happy he's urinating. We're gonna do some blood work and hopefully that's kind of resolved and we can pull that IV catheter, or improving at least. What are you doing?
The person who's drawing probably should hold the hip.
Okay.
Because you're gonna need to.
I know.
Yeah.
I'm so sorry.
I'm gonna try and pull this little shoulder out of your way.
little one. It's okay. There we go.
This poor little heart is beating so fast. You just need like a third of a mil, I think. That'll be plenty.
Okay. Oh, my love, it's okay. Well, it's been about 48 hours and Clancy's blood work is so much better. All of his values are normal. His phosphorus, calcium, creatinine, BUN were so high when he was obstructed, but just a few days of fluids, unobstructing him. He looks like, hopefully, he's not gonna have any long-term effects. So that is amazing news. So I think Clancy is well enough now that we can go ahead and vaccinate him. And he looks like he's urinating in his litter box, which is a definite improvement. He's at least, going bigger amounts and in an appropriate spot instead of still straining. At first, we were just happy that he was going in general, even if it was a million spots outside the box. But now he's able to go in the box, larger amounts. So just headed down the track to be a normal kitten. Well, today we're gonna do surgery on Clancy. It's time for his neuter because he, I believe, is gonna get adopted with our little Winnie. Hopefully Saturday. I talked to an adopter and she was super pumped about Winnie, and I was like, have you thought about it? I gave her my 2 kitten spiel. She said, I'm looking for a male, and I was like, well, have I got the one for you? Clancy pants. Okay, let's get it done. Let's get it over with.
You can stretch that leg.
It's time, Clancy.
Stop.
This dude bounced back from his neuter very quickly. Winnie's a little crabby. Okay. Clancy update. He's adorable. He's hanging out at my house. He's best friends with Bolt, my dog. And he said, pet me. And when Clancy says pet me, you pet him. That is all that you need to know. He's using the big kitty litter box. And I believe he might have an adopter. I can't stand the thought of a single kitten just in a cage crying for attention all weekend. So there he is. Oh goodness, he's so happy. Okay, don't let me bother you. Get back to sleep, okay? Quit eating my plant over there. Doesn't make me happy to see my string of hearts getting chewed up, Clancy. Why is your tail so poofy? Poof poof. What? What? Clancy, get back. Can't keep up with him. He's too crazy. Clancy, come on. It's time to go. Kitty, 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 kitty. He's so handsome. This is such a bittersweet day for me because little Clancy is getting adopted and his adopter is adopting Winnie as well, Winso, my foster. So it's actually the perfect situation, but it's definitely hard to tell them goodbye when you get so attached to them. But thank you guys so much for watching our videos. Thank you for supporting us. Definitely thanks for everyone who donates to Abandoned Pet Project, because without those donations, we could not take on medical cases like this. Like our little man who is going to be euthanized. Thank you guys so much, and we'll see you on the next case. Bye. Bye, baby. Love you.
We're gonna go in the car. We're gonna go in the car.
Bye, Winnie.
Winnie, look.
Love you, sweet girl.